The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You are listening to the 5-Second Rule podcast presented by APIC, the Association for Professionals in Infection Control and Epidemiology. This podcast is produced by the APIC Communications Committee and is intended to be a conversation between our hosts and professionals practicing in the infection prevention and control industry. You will learn and be entertained, but most of all, we hope you will be inspired by our community and the work of our peers. And now, on to the show.
Welcome back to the 5-Second Rule podcast. We are your hosts. I'm Kelly Holmes, and my preferred pronouns are she, her.
And I am Lerenza Howard, and my preferred pronouns are she, her as well.
Hey, Lerenza, how are you?
Hi, Kelly. I am doing great. How are you?
Good. We have a great show today. Today, we're joined by Dr. Heather Gilmartin. Heather is APIC's 2023 Distinguished Scientist Award recipient. She currently works with the Veterans Health Administration, Seattle-Denver Center of Innovation as an investigator and research health scientist. She's an assistant clinical professor at the Colorado School of Public Health, University of Colorado Anschutz Medical Campus, and the Associate Director of the Dissemination and Implementation Science Research Core at the Colorado Clinical and Translational Sciences Institute. She brings over 20 years of clinical practice as a family nurse practitioner in areas such as acute care, family practice, infection prevention, epidemiology, and public health. Dr. Gilmartin is also an executive leadership coach with the VA Leadership Coaching Cadre. Welcome, Heather.
Thank you. Sometimes I hear that and I think, oh, I need to maybe do less.
Yes, it's impressive. It's very inspiring. We are happy to have you here.
Such an honor. Welcome on the show, Dr. Gilmartin. I would like to know your background is so intriguing, and it's something that I don't believe I've ever come across someone with such a background. So please share with us how you got your start in infection prevention and what led you to focus on research that would advance infection prevention and control practices.
Yeah, my story is, I'm sure there are lots of me out there, but I was a family nurse practitioner in a rural hospital in Colorado, and rural hospitals, you tend to be all in if something happens. And so we had some infection prevention issues, and my chief nurse asked if I could pitch in and help out doing some outbreak investigation work. And I had known that team was there, but it was not something that I had ever really studied. So I got pulled in, right? You guys know the routine, like doing chart reviews and talking to the micro people. And I thought, this is super cool. Like, I didn't even know sterile processing existed, right? This was this group down in the basement. But then as time went on, there was turnover. And so I was asked to fill in with the infection prevention group. And ultimately became, the lone infection preventionist at this hospital. And my chief nurse, in all her wisdom, said, go find your people, because I can't teach you. And so I was sent to an APIC meeting and walked into this monster ballroom and thought, oh my God, who are these people? And why are there so many? And then as I was listening to the talks, I realized this was an incredible profession. These were incredibly smart people, and all of our work was based in science. And I realized I think I wanted to spend more time here. So I transitioned over to being the nurse epidemiologist at our hospital. And along the way, I built my community, right? I got to know everyone in the Mile High chapter, spent a lot of time with the big Denver people to learn what they do, the public health department as well. And really was able to bring my rural hospital some of the big city science, shall we say, which was fun. And that's where I got engaged in research, because there are a lot of scientists who want to understand the experience of rural hospital care. And so they would reach out and say, hey, can we use your data? And I would say, sure, but you have to teach me along the way. And that sort of nudged me into the world of research. Then the PhD happened because I didn't know how to do qualitative work or big data analyses or theoretical, understanding of big complex topics. And that's what the PhD taught me. I'm still in my rural community. It's super fun to still be here, but my work is now in the Veterans Health Administration, which, as many of you know, is the largest healthcare system in the country. We focus on providing, high quality, safe, equitable care for veterans, and we do that through putting science into practice.
Wow.
Heather, that's amazing. And again, so inspiring. So you're talking about putting science into practice. And I think as IPs, we are all faced with that challenge. We're reading the evidence-based guidelines, and then we're like, okay, how can we make this happen at our hospital and make it happen successfully? So that brings us into the implementation science term, which I love. So tell us about that. What is it? How does it work?
Yeah. So, of course, we create a new science all the time. That's where the big money goes, right? Creating a new cell line, a new drug product, right? Coming up with a new invention. However, there's so much research that has never been put into practice, right? It's sitting in a publication somewhere in a dusty binder. And the VA, I think, has been doing a better job of this than almost anyone else in the world. And they identify, yes, we need new knowledge, but that knowledge needs to be put into practice to take care of veterans right now. I didn't even know implementation science existed until I came to the VA. It's a relatively new field. But my colleague, Dr. Patty Grota, who has been a long-term APIC member, gave a presentation in Academy Health about her work in infection prevention. And she said this lovely statement, which was, infection preventionists were the first implementation scientists before there was even a term. And I just loved being in the room when she said that, because it is true. Since Semmelweis, right, who has been recommending that people wash their hands since the 1800s, here we are in 2023. And what's the average hand hygiene rate in most hospitals, right? Like 60% if we're lucky. Mm-hmm. So that research to practice gap is something that the field of infection prevention has been really focusing on for 30 years. The technical term for implementation science, it's a study of methods and strategies that facilitate the uptake of evidence-based practice and research into regular use by practitioners and policymakers. It's a systematic approach, right, to close the gap between what we know and what we do. And how do we do this? I won't even get into the frameworks and the theories. They're super fun if people like that stuff. But, we address, barriers. We stop the use of unproven interventions, and then we make room for the ones that are newly evolved, and then we adapt them to the context. Right. And that, I think, is the gift of what infection preventionists do. They know that just because it was done at University of Michigan, it's probably not going to work in rural Colorado the same way. And so we make changes. You may not know it, but most of you are following some incredible theories and frameworks to do that. Be happy to talk about that at another point. It's a science, and it's pretty intuitive. Most of the theories and frameworks have come from the fields of management, business, psychology. We steal them, right? And then we adapt them to healthcare, which is really fun because you read completely different literature than the stuff we mostly read.
Oh, I love that. That's such a good point about it being a science, because there's a way to do it well, and there's a way to, where it kind of falls flat, where you try to implement something and it's not quite as successful. So I do like thinking about it as a science. And if we can implement one thing well, maybe we can take what we learned about that process and apply it to the next thing that we're trying to hardwire.
Absolutely. And one note that really stuck out to me is ensuring that you're putting it into context based on your organization. And I think you're probably preaching to the choir for rural IPs. And one of the notes that you indicated was to build your community. So it's very pertinent to put that science and the literature into practice, but put it into context for your specific organization. So, Dr. Gilmartin, I would really like to know, how can IPs get a start in research and contribute to the literature of infection prevention? I know that prior to me starting my doctoral program, this was something that I was very curious about, but I didn't really know how to start.
Yeah. Well, congratulations on starting a doctoral program. That is no small feat. Goodness. I think that people want to get into research for lots of reasons, right? They want to go get a doctoral degree for lots of reasons. For myself, I went back to get a PhD in nursing. I'm a triple nurse, right? My undergraduate, master's, and PhD is in nursing. So I committed, man, early.
A triple threat.
I'm a triple threat,
yes.
Man. I do nursing good. I didn't do it for the title. I didn't want to be called Dr. Gilmartin. I did it because there were methods and theories and frameworks I could not understand. And then there were questions I wanted to answer that no one else had. So that was my why of doing research, was particularly around the patient experience of being in isolation. My sort of in the early 2000s, we were putting so many people in MRSA isolation, C. diff isolation, and people were suffering, socially and emotionally. And then the staff were having a hard time giving quality care because we were sticking people in these rooms by themselves and having them gear up. So, I wanted to go figure out what was that experience so we could do it better. So I went into research with this very little focus, which is, what most of us do. And then you go into the program and you realize the world is monster and there's so much that you can achieve by just learning the methods. So, you learn all your fancy statistics, and you learn all about ethics and institutional review boards, and you learn about how to use qualitative data to inform quantitative data. And because you have that grounding, you can answer any question. But to go back to, Lerenza, what you were asking, how can an IP get into research? They probably are anyway. You guys collect a lot of data, and your data is used across the world, either through the National Health Safety Network or any of the CDC programs. And so maybe find out if someone's using your data and reach out to them and say, I collect that data. Can I sit in on some of your meetings and learn what you're doing with it? Can I maybe, submit some of it as a poster to APIC, right? I would love to learn how to share my work. And then maybe, as you keep working with people, you create a team, and research is a team sport. And so you contribute, and they see value. And then eventually, you'll be brought into a team. You often need the PhD to apply for national funding. Actually, I know you do. You need, it's a PhD for national funding. But APIC gives money. SHE gives money. IDSA gives money. And there are foundations that could fund your research if that is something that you are looking for. So as an infection preventionist, we often come in, right, and we're taking existing evidence and putting it into practice. However, I work with a lot of students and fellows, and I always start off any of my first year talks with this poem by Mary Oliver. And Mary is an American poet, and she gives instructions for living a life. And she says to pay attention, to be astonished, and to tell about it. And I start my year with fellows with this because the idea is pay attention to the world around you, right? Don't come into your office, sit at your desk and, do your work. Look around, read weird things, right? Talk to weird people, see what other places are doing, pay attention. And if you see something that you think could be brought into your life or to your work, then do. And that could be, let's just say a new hand hygiene approach, right? To get people to wash their hands. And so you bring it into your setting, but instead of just saying, this is best, I'm going to do it, you go around and you ask people very humbly, I think this might work for us. What do you think? And then you be astonished by their feedback, because ultimately they know what's going to work probably better than you. So be astonished, collect the data, adapt the intervention to the context which your folks have shared, And then whether it works or whether it doesn't, tell people about it. And that could be writing a formal, paper that you submit to APIC. You could share it on a 5-second rule podcast, put it in as a poster, a blog, you have to tell people about the work you're doing, because there could be a lone IP out in rural Colorado who is going through the same thing and finds your work and thinks, oh, thank God, now I know what to do, and sings your praises. And that's pretty cool.
That's amazing, Dr. Martin.
Yes.
Thank you for sharing that. It's definitely important to know that research is not a one-person show. Definitely utilize your resources effectively and impactfully. And one thing to note for me is definitely paying attention to your work, because we do some amazing and impactful things within our work, but sometimes with the redundancies of coming in and dealing with the surprises, sometimes that gets away from us. But definitely pay attention to what you're doing on a day-to-day and how you're impacting your patients and facility, and share that work, as you noted, Dr. Gilmartin. And one thing I wanted to add was utilizing, for some of those individuals with a quality background, maybe with Six Sigma, Lean, utilizing that Lean approach of going to the location, look and go see. Thank you for sharing that.
I love that
going
too.
to Gimba. I love that stuff. Yeah.
The research mindset, just hearing you talk about it got me excited about it. I think it's a beautiful way to think about what we do and how we live. A lot of our time is spent at work, and a lot of us chose this profession because we want to make a difference. And I think, we are all quietly making a difference every single day. And so if we can pay attention to that, write it down, share it with others, it's a beautiful way to live. So thank you very much for sharing that. And then I also really liked the point that you made about starting small, maybe with a poster submission for APIC or for SHE before maybe you have, the guts behind you to request that funding or go further down that path or submit a paper. But so, say I am doing some good work at my hospital and I want to share it. So what do I do next, Dr. Gilmartin? You mentioned the IRB approval. I know I don't need any funding for my project. I just kind of want to write it up and share it. So, what kind of permissions do I need to look for within the facility to be able to do that?
Yeah, absolutely. I think I want to change a word that you said, permissions, from permission to consultation.
I love that.
Because we have yes, it is a bummer to have to go through regulatory approval and get union approval for all of our approaches. If you have that mindset, it is a bit drudgery. However, the way I frame it is, when I'm putting together an idea and a project, I need as many brilliant people to look at it and to poke holes in it, right? Because I want it to be as well crafted as possible before I go in and do it in a setting. And so the IRB, the Institutional Review Board, this is incredibly well-trained experts in clinical trials and scientific methods and ethics, who will look at your proposal and advise you on where to make it better. And so if you have an idea, be it quality improvement or research, and quality improvement probably would be more like if it's in a single setting, right? Research is when you're trying to take an idea and make it generalizable, so across settings. And again, IRB will tell you, this is research, this is quality improvement. So don't sweat which one it is. Go talk to them. Most of the time, IRB review is free and very kind. Unlike peer review, which they can be wicked, IRB is lovely. Same thing with union. They are protecting their incredibly busy clinicians to say, look, too much is going on. Please don't launch another survey for our very busy and tired nurses. And then you might need to get executive approval within your institution. That also is really a good political move, because they might say, this is important. Maybe I need to help give you more resources, or this isn't the right time. It's not a priority. You then come in and be astonished and say, tell me why. And you can learn what are the institutional priorities and when might be a good time to bring yours in. You just have to be patient. It might, the time will come. Go to a local academic institution and see if you can have people partner with you. Students are always looking for people to write with. So, reframing IRB from a requirement to, honestly, it's a gift to have them work and look at your stuff. It takes time though, right? You have to write these things down. You have to think through them. Use your PICO questions for those of us who remember those things. To make it a formulaic approach, use a scientific method, because you don't want to put a bad project into the field. It wastes people time and it wastes people's money. And most people don't have that much anymore.
So true. So true. So Heather, do you feel like that pathway is the same if you're at a small facility versus a very large medical system?
I think so. So my rural hospital, we didn't have an ethics board. So we went to the Colorado Multiple Institutional Review Board when I had work going on. And, they were happy to look at our projects. So you just have to find out where they are. Most big academic centers have them as well. However, so for instance, I work with Dr. Shelley Kahn from the Rocky Mountain Regional VA. She's the head of infectious disease, and we have a couple fun quality improvement projects going on. So she just submitted a blanket QI request for all of the work that she's going to be doing this year, and she got the thumbs up. So easy peasy, it was, yeah. So again, get to know your quality folks, get to know your IRB folks, get to know your research folks. Bring coffee, hang around, attend their meetings, whatever. Eventually they'll be like, whoa, where'd you go? How come you're not here anymore? Boom, you're part of the team.
That's definitely a great tidbit to utilize your quality and your research department if your organization has one. It's definitely, from my purview, important to have that IRB approval if it's required, just to ensure that your study is ethically sound. We want to ensure that any respondents or participants are protected within the studies and that we're being ethical in our practices. So as I previously noted, I'm in a doctoral program specifically for health science. I would like to know from your purview, what advice would you give to IPs that are considering the pursuit of a doctoral degree, maybe like myself, a doctor in health science or a PhD or a doctorate in public health? And in addition to that, what APIC committee should they pursue if they're interested in research?
Oh, these are such good questions. So I would say, my father always said this, education is something no one can take away from you. So whether it's open access learning, right? You're reading the APIC and itchy journals every month, that's your education, all the way to taking some of the free online education that is out there through like edX, TED Talks, Coursera. Knowledge is important and it makes the world a better place for people to be educated. If you choose to go the very academic route and get an official degree, make sure you have your why on track, because it's not going to be easy, right? I mean, Lerenza, you must know this.
No.
Where do you fit it in, right? No, I don't know. But the advanced degree is an incredible thing to achieve for our field because we need more. I remember speaking to Pat Stone at an APIC conference, who was the APIC editorial editor, and she said, we need more scientists here. We don't need physician scientists. There are lots of those. We need the nurses, the masters in public health, the microbiologists, the medical technologists to learn the scientific methods and then apply them in their field. And that is true now more than ever. Our field is moving so quickly. So Lerenza, I congratulate you. You have a lot of work ahead of you.
Thank you.
But in regards to APIC committees, so I joined the public policy committee. That was my very first APIC engagement, and I loved it. That blew my mind how much influence we have on government by writing policy recommendations. Then after that, I actually joined the APIC text group and helped edit and then write some of the chapters. Again, never knew that stuff was out there, but learned a ton. And, they don't expect much of you in the beginning. And then as you are on the committees longer, they expect you to have learned and take over. And then the research committee is a fantastic place. They are constantly looking for new ideas, reviewing people's ideas, right? That's a place you can set into your articles if you want someone to look at them. And all of this opportunity can take a newbie, a rural IP, right, from nowhere, Colorado, into wanting to do a PhD and then, a fellowship. And now I'm a nationally funded researcher, and I only do research. It's 100% of my job right now, which is a monster privilege. And I get that. But start small, right? If you can do research 20% of your time, 10% of your time, and your goal is to publish, do that as you're heading towards a doctoral degree, because you need to know you're going to be heading into a world that is write a grant, write a paper, write a grant, write a paper, maybe get to do the research, write a grant, write a paper, write a grant, write a paper, maybe get to do the research. It's sort of tough, but it's super worthwhile. Wow. If I didn't sell it, call me and I will push you into a PhD if you want it. But if you don't want it, I can talk you out of it.
That's a great strategy, tying it back to what you noted as far as building your communities. If research is something that you're passionate about and you want to learn more about, you can build your communities by potentially joining the APIC committees that Dr. Gilmartin noted.
I will tell you that the APIC meetings for me, I went in just to do serious social networking, right? And I would skulk around in the hallways waiting for some of our keynote speakers to come off the stage, and I would have like questions written on cards. So Sanjay Saint, Sarah Krein, Elaine Larson, Pat Stone, I would be there waiting, like, I have a question for you. But those developed into phenomenal professional partnerships. And then my own peer group, people from Columbia, like Amanda Hessels and Monica Porgazelska-Mazaraz. And then in Colorado, Sarah Reese, Sarah Smathers from CHOP. Like, we just met at meetings, we met on committees, and now we've done research and written papers together. So if you're sitting next to someone in an APIC meeting, turn to them and shake their hand and say, what do you do? And they probably are looking for someone to do work with as well.
I would implore listeners to definitely at the APIC conference, if you're attending in person, if there's someone that you admire, introduce yourself, maybe discuss some of your interests or some of the things that you found through your research, indicate your interest in their studies and build relationships in that way.
Yeah, that's great advice. Yes. And it just kind of, it can be super scary to do all those things that you just described, Heather. So, but I can picture this with you and your note card standing in a hallway, waiting to talk to somebody. And that gives me strength. Like, I'm like, okay, well, she did it. I can do it too. So thank you for sharing that. And Lerenza, I'm also super excited to follow your path, through your doctoral degree too. So that will be exciting. So Heather or Dr. Gilmartin, I was thinking back to what you said at the beginning of the show, and we were talking about Semmelweis. So, I don't have 200 years to get this, to get this down or to make a change. So, what do you suggest for our listeners if they're going to walk out, after they listen to this podcast and walk into their office? What is a tip for implementation that they can take away today and put into practice?
So for me, it's context. Understand the context. So if you read Semmelweis's history, he was not a very nice man. He was pretty bad at sales and marketing. And he he drove himself crazy, right? So I would say if you have a brilliant idea and you have the data to show that it needs to be done, and you need to first build your coalition, right, of the willing. So we can use hand hygiene, for instance. If your ICU has some issues, understand from the people. Go to GIMBA, right? Go ask them, what's going on? And be the sounding board, be a qualitative researcher, go in and listen without judgment, with humility, and then take all that knowledge and figure out what is it that you can do, what other hand hiding intervention is out there that might work. Are there incentives, right? That's a whole field of behavioral science. Is there the industrial design piece? Are the sinks in the wrong place? Is the soap super irritating? Is there an opportunity to reward people for good behavior instead of penalize them for bad behavior? So this is the fun bit, I think, of the work. So for instance, when I first started as an IP, I started putting poetry in the bathrooms in our hospital so that while people are washing their hands for 15 seconds, they could have a moment of Zen and read some poetry. And it was like my favorite thing. And people still remember me for that for some crazy reason. But again, it was like mixing mindfulness with hand hygiene, which is something Dr. Sanjay Saint and Todd Green and I have been working on at University of Michigan for a while. So is there a way to integrate something people already are doing into your practice? Where would that come from? These ideas came to me from TED Talks, from really awesome podcasts like the 5-second rule. And then you bring them into your infection prevention or epidemiology world. So if I could give IPs one piece of advice on how to, do that work, leave the epi literature to the side and get into behavior change literature, get into the ethnography literature, get into honestly the classics, right? Like Shakespeare has a lot of stuff to teach us that we can apply into our world. Way more fun than reading, a paper with 14 tables and 6 supplements. And you're like, I don't know what this is saying.
Ooh, that's a great tip. And I learned a new word today, ethnography.
Yeah, if you want to read a phenomenal ethnographer, Mary Dixon Woods, who works with Peter Pronovost on the Keystone Project, she is probably one of the finest writing in this our field. So I highly recommend you read her stuff.
Yeah, I definitely learned about ethnography in my doctoral program. So some of the terminology you're bringing up definitely rings a bell. So
awesome.
Thank you for sharing this information. But what I would like to know, in addition to that, is from your purview, what are 2 areas of research that APIC members should consider? And what are some of the gaps in our knowledge base currently based on your findings?
So many of us joke that research is really me search. So it's, you research what interests you. So from my standpoint, I think the two gaps that we should really focus on in our field. One is focusing on the people doing the work, right? We know that employee well-being is a major focus currently, U.S. Surgeon General, National Academy of Medicine, because our, across the world, healthcare providers are burnt out, right? And they're leaving the field. And then the other sort of gap that I think we really need to focus on is that implementation science piece. What is causing so much of our evidence not to be adopted into practice? Is it because you're not disseminating it well? Nobody knows about it. Or is it because you're implementing it without respect to context? And again, there are theories and frameworks. There are fantastic organizations that you can work with. So those are my 2 areas, employee well-being and understanding implementation science, barriers and facilitators.
That's great. I think that's an important point to present is dissemination as well. We have this great work. We are possibly submitting to APIC or SHE or other bodies, but just ensuring that you're working towards dissemination to advance the literature and potentially assist other organizations with whatever issues it is that you identified and found possible solutions for.
Mm-hmm. Absolutely. Yeah, yes. You'll never know the impact of your work until you're coming off of a presentation and someone is standing out in the hallway with a note card saying your work has driven everything in my field and I'm super excited to talk to you about it. That's when you're like, oh my gosh, someone read my paper. That's so fun.
I love that. And the emphasis on the organizational context and how it matters because the IP or the nurse can have the perfect checklist, but we don't necessarily have the voice. So you have to build that community, as you referenced, to be able to successfully implement that change and have it be sustainable.
Oh, 100%. Yeah. Kelly nailed it.
So, we like to ask our guests a couple questions before we let you go, Dr. Gilmartin. So I was wondering, what is something you wish someone would have told you at the beginning of your IP career?
Oh, I really wish someone would have told me to be kind to myself. As a lone IP, I took on the entire institution's burdens on my shoulders and beat myself up a ton. And so I wish they would have told me that. And then I wish they would have told me earlier to really build my community, right? I was alone doing that work for a while. And once I found APIC and made connections through my committee work and the APIC text, when I had an issue, I could reach out to someone and they would say to me, oh, give me a break. It's not that big of a deal. This is how you would handle it. And that was what I needed. And so I wished people had told me that earlier. It only took me like 10 years to figure it out. So
And coming from the perspective of someone like myself who, I was thrusted into this field at the height of COVID. So feeling like you have the weight of the organization and the weight of COVID and the ever-changing guidance. So I definitely identify with that, to give yourself grace. The second question that I want to know is, what strategies do you use to remain abreast of ever-changing guidance in IPC?
Such a good question. So I am part of this Dissemination Implementation Science Research Core at our Translational Sciences Institute. And we get this all the time. People are like, I published a paper. How come everyone doesn't know about it? And we say, because nobody reads, and there are 1 million papers published each year. So what we encourage most scientists to do is to use like a Google Scholar alert. So you go into Google Scholar, right, which is free, and you find, let's say, an article that you loved. You can put an alert on it so that any articles that reference it or are similar to will come into your email. You can also follow Elaine Larson, Pat Stone. You can follow me, right, as researchers. So anytime we have something published, it will pop into your box. Actually, often before even the author knows, which is sort of fun. I've emailed people like, I love your new paper. And they're like, it's out? And then you can also just follow topics. Like you can put in hand hygiene. That might overwhelm your inbox. But, you can direct it to a certain folder. And that's like your guilty pleasure reading. You go through these new articles once a week. And it will expand your entire world. Because the beauty of Google Scholar is it also scrapes from different places, so beyond PubMed. So you might get the Iranian Journal of Public Health, which apparently a group from Iran used one of my ideas, and I was like, that is the super coolest thing ever that they use my research.
That is this, you're making a difference, Dr. Gilmartin, and I think that's so powerful and it's inspiring. So everything that you've shared with us today is helpful. And I think we can all walk away with a few things that we can put into our daily routine to help us become better implementation scientists and build our community within the hospital and then among APIC and the research community as well. So I have really, really enjoyed this. I could talk to you for hours. So thank you for sharing and joining us today on the podcast.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.